Today's topic is going to be on a very common topic but often ignored topic on how do we maintain our tooth and gums, what should we do to improve the health of our teeth and gums, and how do we ensure that any initial signs of decay or gum disease can be spotted at an early stage itself. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental center at Chennai Raja Annamalapuram since the year 2001. If you have not subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to general health and maintenance, we have to speak on two things. One is how do we maintain our teeth and gums? Two is what all steps should we take to improve the health of our teeth and gums. So now let's look at the maintenance part. So when it comes to toothbrushing part, so that's the most commonest question, right? So when it comes to toothbrushing parts, there are few important things which we should note. One, what is the brush that we are using? Two, what is the technique we use to brush our teeth? Three, how many weeks or how many months once do we change our brush? And also most importantly, how much of force do we use to brush our teeth? So these are some of the things which we should note. So when it comes to the brushing, always prefer a soft brush or a sensitive care brush for brushing our teeth. So why do I say this? So a bristle which is soft or of sensitive care nature are very gentle to the tooth enamel, or sometimes when there is gum recession, or they are gentle to the cementum, that is the root surface of the tooth, and also to the gums. So because they are very gentle, there is very little wear of enamel that happens because of the brushing. So it's very essential not to use a hard brush or a medium brush. Always pick up something that is soft or a sensitive care brush to brush our teeth. That's important. Second is, of course, what is the frequency of brushing? There are people who brush only once. There are people who brush even 5 times a day. I've got a spectrum of people coming in because there are few people who are paranoid about bad breath. So every time they have their meal, they brush, right? So both are not great. So just brushing twice a day is sufficient. Once in the morning and once before going to bed at night is very, very essential. And so twice a day brushing is essential. 2 minutes per brushing is more than sufficient. 2 minutes in the morning and 2 minutes in the night. Very importantly, when we brush, it's important that we stand in front of the mirror and then brush our teeth, because sometimes we'll be watching TV or involved in some other activity, and when we brush, we don't focus on the brushing. And because we don't focus on the brushing, there are chances that we hurt ourselves, we hurt our gums, or we only brush certain teeth and then we skip a whole lot of teeth. So that's also going to cause harm. So it's very essential that we stand in front of the mirror and brush for those 2 minutes. So soft brushing for 2 minutes. And the next thing is the technique of brushing. It's very important. Of course we have made videos on how do we brush our teeth, be the upper teeth or the lower teeth. I would suggest that you look into those videos for you to know. But in short, when you use a force to brush our teeth, the force can come from our shoulder, elbow, or it can come from the wrist. So when you use our shoulder force to brush, we can apply too much force on our teeth, which can wear the teeth. Essential is to use our wrist motion, gentle rotary motion or a gentle to and fro motion will help to clean the teeth effectively and also prevent any wear. Of course, there is a whole lot of technique. How do we do that? We have explained in a video where we have shown a demonstrator how we can brush our teeth. Suggest that you have a look into that video. How frequently do we change our brush? It's important to change our brush once in 3 months, and most importantly, when you change your brush, the bristle should not be completely flared off or worn off. When it's flared off or worn off, it means that you have used too much force to brush your teeth, which is not a good sign. So ensure that you change your brush once in 3 months, and also it's important that the bristle stays as good as a new once in every 3 months while you change the brush. So this comes to the brushing part. The next comes the important thing is the tongue cleaning, often ignored subject. We don't clean our tongue. Food and bacteria can form a coating on our tongue, can result in loss of taste, most importantly can result in bad breath. It's very essential we clean our tongue. How do we clean our tongue? We can use the same brush what we are using either the back end of the brush if it's got an inbuilt tongue cleaner with it, or the bristles to clean the tongue. It will gently clean the tongue. Don't spend too much time in cleaning the tongue. Just a few seconds will help. Ensure that it will remove all the coating on the tongue. So that's very essential. Importantly, don't use a metal tongue scraper. A metal tongue scraper can remove all the papilla, that is the taste buds that are there on our tongue, can also result in inflammation of the tongue. Don't use a metal tongue scraper. A gentle cleaning with a brush or a soft plastic handle that is behind the brush is sufficient to clean our tongue. So these are two essential things, that is brushing, next is tongue cleaning. Next is the gum part. It's essential that we massage our gums. How do we massage our gum? Using either the pulp of the thumb or the index finger, we can gently apply pressure on the tongue, apply a small rotary motion there. This improves the circulation in the gums. So this circulation in the gums will help to keep the gums healthy. So just a gentle massage, it will help to improve the health of the gums, improve the blood circulation. Most importantly, if there is any inflammation, if there is going to be bleeding when we press the gum, it's a sign that there is an issue that is happening. We can always attend, we can go meet our dentist and see what needs to be done for that. So these are some of the important things which we need to understand. The next part is a visual examination. So what do we mean by visual examination? When we brush our teeth, essentially we check our teeth and gum in the mirror. Any black spots on the teeth or any red spots on the gum is a sign of concern. It can be that when you see a black spot on the teeth or a red spot on the gum, it's essential we meet a doctor, dentist to check it, because it can be an early sign or an early stage of a gum disease or a tooth decay. It's essential that we address it at a very early stage. Check those signs for either a black spot on the teeth or a red spot on the gum, so that we can go meet our doctor and then take necessary action. The last part I would say is a mouth rinse, because people commonly ask what is the best mouth rinse to use. It's not mandatory that we always use a mouth rinse. A simple mouth rinse would be a salt water, a warm water, salt, completely mixed, can use to gargle our mouth and helps to keep our mouth clean. When it comes to taking care for long-term maintenance of health, it's very essential. Rinsing is some often ignored thing, especially at office when you're outside. When you eat something, say that we have a coffee or a tea, and it's often with sugar, and we always couple it with some snack. It can be a biscuit or it can be some other snack. We usually don't rinse our mouth. Often the excuse is, I'm outside, I can't rinse my mouth, it's not possible to rinse my mouth. I understand that. So if it's not possible to rinse your mouth at that particular point of time, it's always maintain the long-term health. So these are some of the simple steps which we can ensure, which we can follow to ensure health of our teeth and gums. If there are any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.